Welcome to Malpractice Podcast.
How was your day?
It was good. Work was really chaotic. Looking forward to the day when I can quit my job.
Sydney has a beard. That's why I'm asking her.
And podcast full time. That's my goal.
Yeah, that would be cool. Yeah, mine was the same. I'm pretending like everything's fine all the time.
Mm-hmm.
So first, let's follow up on some questions that came up with the last podcast.
That was me setting my beer down, and you're going to hear that multiple times. Okay. So from our last episode, a few things came up about lobotomies and specifically Dr. Freeman and what happened to Dr. Freeman. Several people who listened to the episode wanted to know. So I have a little bit of an update, and then Jessica has some really cool information that she found about lobotomies that is going to blow everyone's mind. So Walter Freeman performed his last lobotomy in 1967 after he basically inserted his little ice pick tool and severed a patient's blood vessel during the procedure, resulting in the patient's death 3 days later. So that was his last ever lobotomy that he performed. Now, I read a really interesting article in the Washington Post from 2001, so it's a little bit old, but the author's name is Jack L. Hyde, and it was a really interesting article because he interviewed the son of Dr. Freeman, who remembers holding patients down as a child while his dad was giving them the electric shocks to knock them unconscious.
What an internship. Really.
Right, yes. Oh, he also became a doctor.
Stop.
Yes, he did.
No, what kind of doctor is he?
I think he also became a neurologist.
That is weird to me.
It is very weird.
Like, there are lots of doctors to be. Be a different one.
That's a great point. And I think it's really important to note that in a couple of different articles I read, Dr. Freeman got his first neurology internship because his grandfather worked at the hospital.
White men just
nepotism.
Hires while everybody else is
nepotism.
Having lobotomies.
I think it's also important to note, because you had asked me this last time, like what's the deal? Is he dead?
I want to know if he's dead.
So he was never investigated or anything for this. And
well, I think they knew what he was doing. At the time, right, they were like, good job.
Well, yeah. So several people had looked into the practice of lobotomies, but they didn't find that he had committed any wrongdoing specifically.
I mean, an ice pick to the head is wrong.
No, right. Yeah.
I mean, I found that myself. And I don't know anything.
Independent research.
I thought about it and it's wrong.
Yeah. So Walter Freeman died in 1972. And basically based by the time that he died, his theory that you could cure mental illness by physically attacking the brain's frontal lobe had been fully discredited, obviously.
We just did it, actually, 3 seconds ago.
Yeah. When he passed away in 1972, he had cancer, and he died of complications from a surgery where they were removing the cancer. So that's how he died. And when he died in 1972, the general consensus from the medical public was that he had done wrong. Correct. So, like, he died having been, outed, basically.
As in a psycho.
Yeah.
He is.
Yeah. Which I don't know about everyone else, but that brought me a lot of solace.
Yeah, it's great. I love it when people build themselves up to be great, and then when they're done doing the bullshit, people are like, actually, that was trash.
Yeah.
Everything you just did was trash.
Yeah. So what I will say is a little disappointing is a lot of neuroscientists today do celebrate him as a pioneer who was far ahead of his time for treating psychiatric disorders.
But we should say a lot of neuroscientists are what?
Old white men.
Yeah, I mean, like, of course they're like, that was a good idea.
Yes.
Like, okay, go sit down somewhere. I found out that Medicare and Medicaid recently stopped covering lobotomies.
How recent?
Like 2014. They're like, no, we don't do that anymore. And then I also found, I couldn't find an insurance company that said they would cover lobotomies, which gave me hope. But I found many people on threads in spaces such as Reddit, etc., who are like, I really needed a lobotomy. Like, what do I do? And people are like, go to the doctor right now. because you need assistance.
You're probably depressed.
Like,
you probably need some upper.
One specific person was like, I would like a new personality. And someone was like, okay, well, be better.
Do some yoga.
Like, be a better person.
I don't know what to tell you, really, but
oh my God.
That made me take a deep swig of this beer.
And enjoy it. So, yay, we caught up. Feel weird about his son being the same person, but, you know.
Yeah.
I don't think I would ever... I mean, it's so weird. This ties so well into what the fuck I'm about to talk about, too.
Oh, no.
Because some father-son... It's not even alleged. Like, no one complains about him, but it's weird to me when you do exactly what your parents did. Like, that's weird to me.
Especially if you're... Like, have you seen... I think it's Step Brothers, the movie. He's like, well, I always thought I would take over the family business. And the dad's like, I'm a medical doctor.
Yeah.
It's like just strange. I mean, I guess it's not strange to me that people become, you know, they see their parents and they see like a good
inspired by them, right.
Yeah, but being a medical doctor feels like it requires a lot more motivation than just, it's what my dad did, so I guess I should keep doing it.
Yeah. I also feel, per my experience in Grey's Anatomy, as we know, Meredith Grey becomes a surgeon because, you know, she's inspired by her mom. I feel like that's cool because she does something different. You know, she's like expounding and changing things. Maybe I just feel it's weird when men do it. Maybe I have a complex. That feels right. Feels right when I say that.
I do think it's interesting how
judgy I am.
Yeah, I don't mind it. I recognize that I also have some biases, such as
me too,
toward men. It's not men, it's that I don't take criticism well from... It's like a woman can tell me that I'm doing something wrong, and I'm like, no, you're probably right. And then if a man says it, I'm like, how dare you?
Yeah, no.
The audacity.
The audacity. Okay, let's get into this.
I'm so excited.
This new episode. First, I want to warn our listeners, this episode of our podcast will be mentioning sexual assault and rape. We understand that for some, this can be traumatic, and we want to prepare those who have painful experiences that this may be something that they don't want to listen to. And as allies for those who have suffered, we want to conduct ourselves with respect. So just letting everyone know that those references will be made. Okay, let's talk about fertility fraud. This is a whole bag of yikes. And by yikes, I do mean absolutely disgusting behavior.
Oh, no.
So first, what is fertility fraud? Because it sounds like you're faking a pregnancy, but that's not the case. This is in reference to when doctors use their own sperm or don't use the sperm agreed upon on patients. So it's really weird to think about. I'm going to explain a little bit about it, and then I'm going to tell like a couple stories about it.
Okay.
So we all know about at-home DNA tests. These products have been utilized by people to find out where they come from, connect to ethnicities they may not know about, and find missing family members or just to know more about their genetics. These tests have opened up some fact-finding missions, and they're not pleasant. No one really goes into these DNA tests expecting to find out that their father's not their father. There are cases of fertility fraud in 12 states, in England, South Africa, Germany, and the Netherlands that have been exposed, but surely there are more. I know I saw one mentioned, I think Australia, so this is happening everywhere.
Yeah, these are just the ones that we know about.
Right, and I'm only going to talk about one briefly and then one like in depth. So, because it's too much. It's too much bullshit to be talking about one episode.
First of all, can I just start by saying, oh shit. This is a heavy hitter.
It's weird because I was reading people's opinions about fertility fraud, and people have, and we'll get into this later, a lot of mixed opinions. Some people are like, well, they wanted to be pregnant. Don't worry, I'll post the question at the end. We can all think about that for a minute.
For the listeners who couldn't see my face.
It was a serious...
It was highly skeptical.
I want to shout out Dr. Jody Madeira. She's been working towards righting these wrongs through research, text, and advocacy. She calls fertility fraud medical rape, and I'm going to be using that language in the future and for the rest of this episode because I think it more accurately describes what's happening. My personal favorite of her writing so far is her paper, Holding Physicians Accountable for Fertility Fraud, where she delves into the history of this unethical act and expands on physicians who have faced or are currently facing criminal and civil charges. She is a badass. She's currently guiding students at Indiana University at the School of Law. So all of you guys worship her. She is awesome.
Can I just say that we love a strong female protagonist?
We do. I really like, so this episode is all about female protagonists, really.
Perfect.
The reason she came up so much is not only does she write articles and annihilates these doctors in her text and the language, but she's also a part of all the changes that are being made because she's so...
Hell yeah.
Her writing is so good. We'll link to one of the paper because it's like, I didn't do it, but I feel bad for it because of how she writes. Okay, so technology and science are making it easier to find out who these daddy doctors are, but then, like,
Can I just pause and say I hate the phrase daddy doctor? It is a huge bummer.
It is a bummer. It's not, it's very common, though. Like, people are like, these are daddy doctors. But what happens to them? Right now, out of all of the states, just 3 have bills criminalizing this.
3?
3. Correct. Criminalizing medical rape. They call it fertility fraud. I call it medical rape. So does Dr. Madeira. Leave us alone. California, Indiana, and Texas. So California is the OG, and they passed their law in 1995. Indiana and Texas passed theirs in 2019, which is last year.
In 1995?
Yeah, California.
Go California.
I know.
They're always ahead of their time.
Good for you. Yeah. Which is really, that's actually crazy because that would mean that the people who were products of medical rape were relatively young. Yeah. Because it's like the 60s, 70s, 80s that people are realizing that's what happened because those people are now adults. So they're doing the DNA testing. So California was, obviously ahead of its time. And then Texas, shout out to Texas for doing one good thing in its life. And then Indiana, I don't know much about you, but holla at you, girl. You're also cool in my book because of this. So before I get too far into talking about the people, I have to make sure I say this. I'm only going to be talking about doctors who have to have done these things because there are literal people walking around with their DNA. Like, it's a fact that these people exist. So, like, don't try and sue us for talking about things that you for sure did. Okay. Because there is DNA proof, and most of those are extensive beyond the first DNA test. Like, someone will realize, oh my God, I think this is my actual biological father. And then, like, one woman in the story that I'm going to tell, she had several tests, and DNA experts prove that that is her, biological father. So it's not like we're guesstimating here.
So, like, we don't have to say allegedly.
No, this is what happened. This is for sure what happened. Don't come for us. So California's law came from the University of California, Irvine, their fertility clinics, reproductive endocrinologists. Hear how I'm saying science words?
Oh, get it, girl.
They use patients' reproductive material without their consent. And so California was like, that's fucked. So they made it unlawful for another to knowingly use or implant reproductive materials for purposes other than those to which they have been consented. So if you consent for your eggs to be used for, like, research and they used them, they sold them or impregnated another woman, like, you can't do that, and California will come for your life.
Well, that actually makes sense to me. It feels like if your DNA is your property, then your eggs are your property.
Right.
Your sperm is your property. Like, whatever, right?
Right. Unless keep your sperm. It's for you. So in California, if you break this law, you're going to have a fine of up to $50,000, and you're going to spend 3 to 5 years in jail. Well, prison, not jail. So, good job, California. In Indiana, the legislation came after finding out about Dr. Donald Klein, a fertility specialist who was discovered having inseminated many of his patients with his sperm without the woman's knowledge or agreement. This guy did his work during the 70s and 80s, and due to these at-home DNA tests, there are at least 60 people that found out he was their biological father.
60?
At least 60. He is hella gross. He retired in 2009, thank goodness. This is an interesting one because he pled guilty to 2 felony charges of obstruction of justice because he admitted to lying to investigators when they were investigating complaints from 2 of his now adult offspring. So he didn't get in trouble for medically raping anyone. He got in trouble because when they asked him, did you medically rape someone? He was like, no, I never did that. And then he came back and was like, okay, well, I did it.
Okay, well.
So you may have some proof in the form of human beings.
Technically speaking.
If you want to know if I did it or not, they're standing right there, so yes. Really gross. So he's quoted directly saying, I can emphatically say that at no time did I ever use my own sample for insemination to the Indiana Attorney General in a letter. This man ran his practice until he was 70 years old. And eventually he told the truth to the Attorney General, and he was like, yeah, I would use my own sperm whenever I didn't have a donor sample. Because it was so far back in history when he started doing fertility, treatments on people that he didn't always have a donor sperm on hand. So he would just use his own sperm if he didn't have it.
Well, okay, so it's obviously really fucked up that he's using his own sperm. But it's the fact that, if you think the woman would be okay with it, why didn't you tell her? Right?
It's because they know.
Because they know that she's not okay with it. And that's why they never check it with anyone.
Correct.
Because they're like, you would have a problem with this.
Right. So, yes, he's super gross. Indiana's law is based off of this doctor, and it makes it a level 6 felony, which is actually the lowest level of felony. I mean, but we have to start somewhere. For someone to make a misrepresentation involving human reproductive material and a medical procedure, device, or drug. So basically, if you lie and you're a doctor doing these things, you're going to get in trouble. It does 2 things, the law. It allows for civil cases to be brought by mothers, husbands, or the doctor-conceived individuals to receive damages of $10,000 or to seek additional damages at trial. And it holds criminal charges as well. People have up to 5 years post-DNA test or evidence to bring a civil suit. However, it's not retroactive. So, anything that happened before 2019, it's not going to matter. Even though those people are popping up all over the place. That's what sucks about this.
That's terrifying. We knew it was morally wrong before it was legally considered the incorrect thing to do.
Right.
Everybody knows that you can't just inseminate someone without telling them.
And I think it's because we know that it's wrong because they didn't tell anyone.
Right. But that seems like common sense that would be
wrong.
Yeah.
And now Texas, where I selfishly want to spend the bulk of the time explaining the intricacies of our own bullshit. So the law in Texas, as of 2019, makes it a felony sexual assault for a healthcare service provider to use donated human reproductive materials on another person in an assisted reproductive procedure without the donor and patient consent. Violation of this means 6 months to 2 years in prison and a $10,000 fine.
Well, yeah.
It's crazy. It's really good to make it a felony sexual assault because it is medical rape.
Yeah.
So I believe that what Texas has done has called it what it is. And I think it's been able to do that because of the work of one of the first woman I'm going to talk about. Okay. But the law is not retroactive. Again, so it will have no effect on Dr. Kim McMorris of Nacogdoches, Texas, where we're from.
I knew that's where this was going.
So, yeah.
So we're from a small town in East Texas called Nacogdoches.
Right. Yeah. So I'm excited because not much goes on in Nacogdoches, but this is really crazy. It's crazy for anyone, but anywhere.
Anything from Nacogdoches that does make a headline does so because it's insane.
Yeah, so Dr. Kim McMorris has definitely fathered children via his fertility treatment, and the proof is in the form of 2 of these individuals. Well, there are actually several more, but I want to speak about 2 of the women who came forward, Eve Wiley and Jessica Stavena. I'm obsessed with both of these women because their work has changed the law, or really has made a law, and then Jessica is working to still hold McMorris accountable even to this day. So they're awesome. We're going to start with Eve, who I would crown the legal advocacy queen. On behalf of women everywhere, thank you. We love you. So Eve was actually 16 years old when she found out that her biological father was a sperm donor.
Okay.
So she was like looking through her mom's computer and found evidence that she was conceived via like sperm donation. Donor 106. Her father had passed away when she was 7 years old, so it wasn't like crazy out of the norm, I guess. Like her and her mother were really close. And then she actually began a relationship with donor 106. She reached out to him. She stated that it was like a father-daughter relationship. She calls him dad. They say, I love you. This man officiated her wedding. Her children, like, I think they call him Papa.
That's sweet.
Yeah. Love Eve. Love donor 106.
Love that for them.
So they're really just sweet angel people. So her son began having gastrointestinal issues. And they were like acute issues that were extremely difficult. So she began looking into what could be going on with the family health. And she actually used 23andMe and Ancestry.com in an effort to avoid further surgery for her son. He had like 4 surgeries or something before he was 4.
Okay, so she was looking for what was genetically the problem.
Right.
Okay.
Through these tests, she learned that donor 106 wasn't her actual biological father.
Oh my God, can you imagine?
Right. No. I can't. Yeah, let's pause on that. Like, you already lost your father, and then you build this relationship and this life where you include this person, and because of a lie, the truth of it is taken away from you.
Yeah, the relationship is just not what you thought it was.
Right.
I mean, like, it's fantastic that she has this person in her life that she can rely on and that her children have a relationship with. It's just frustrating to build it on a lie that, like, neither of you controlled.
Right. That's the ticket. So she, through these 2 sites, connected with relations and supposed siblings, which led her to figure out that her mother's fertility doctor was her biological father. So Eve had to begin telling people, starting with her mother and donor 106. So she told, she's the one who told her mom. Yeah.
Wow.
Right.
That's horrifying.
Yeah, it's so weird.
I feel like finding out, that just gave me a bone chill. Finding out that someone's sperm was inside of you without your knowledge
is rape.
Is horrifying.
Right? It's rape.
It's rape.
It's weird. So she emailed Dr. McMorris, actually, and he acknowledged in these emails what he had done. And said that she was his daughter, but claims he had permission from her mother. Now, her mother says she didn't want anyone that she knew to be the sperm donor. Yeah. So she's denying that, and let's believe her because
we believe women, yeah.
We believe women, yeah.
Also, why would she lie?
Right. What? And don't you think she would have come clean like 1,000 years ago before her daughter reached out to donor 106?
Yeah. And also, why would she even pick a sperm donor if she wanted the doctor's sperm? Why wouldn't she just be like, by the way, I'd like some of your sperm, doc?
Well, it's because he didn't make it readily available. Like, he just had it as samples from when he donated.
That's extra tricksy.
He's a tricksy motherfucker, this guy. So, he explained in these emails his history. So, he says he became a donor as a medical student and continued to use his own samples as he saw fit. Not telling his patients, because he said, I had to be anonymous and not tell my patients because the protocol said they needed to be anonymous.
But anonymous means someone else.
Yeah, just so we're clear, anonymous means not you, dude. It doesn't mean just like someone they don't know. They wanted to be anonymous to everyone.
Yeah.
Also, like, she chose donor 106.
Yeah.
Like, she chose, they said, this is my donor.
Right.
As someone who's going to have to go through this process, if I spend the time to choose,
it acts like your genetics are irrelevant or they're perfect, right? Because the assumption is just like, I don't have anything wrong with me that I could pass on, but that obviously wasn't the case.
Yep.
He had this rare gastrointestinal issue.
So he says to her, quote, I hope this can be of some help in confirming your roots. And he let her know that she would have more siblings out there, of which about 7 have been confirmed.
For reference, our hometown has 30,000 people. Mm-hmm. So
it's weird. So after Eve finds out all of this shit. She's like, what the fuck? So she talks to a friend, and she finds out that this is not illegal in Texas. And she's angry. So she takes her fight to the Texas legislature with her mother.
Hell yeah, she does.
And they go and testify. First, they get Senator Huffman and Representative Click to sponsor the bill, and they testify in committee hearings, and they're lobbying in offices. And she is really the driving force behind this. So she passed the law.
Good for her.
It's Eve's law.
Yeah, I love this.
Yeah. So now let's loop in Jessica. So her mom, Pauline, also went to Dr. McMorris in Nacogdoches. Y'all, I just want to point out, Nac is, like, small, so pickings are slim for fertility people. It's not like everyone's just making horrible choices. It's like, he's the one, you know. So Pauline, Jessica's mom, also used a donor from a California sperm bank. After multiple attempts that didn't work, McMorris told her, I located a local sperm donor, which he described as a tall, redheaded, music-loving medical resident from a hospital. He then administered the sample. He is describing this person to her as though this college kid...
Like,
right?
It's a random person.
No, he's just thinking about how cute he thought he was 25 years ago.
Yeah.
So Pauline wanted to be pregnant, and after, like, several... She's like, okay, whatever. So Jessica was having gastrointestinal issues as well and wanted to know what was going on. She used a consumer DNA test to figure it out. With her results also came several half-siblings. She knew that she was, conceived via a donor, so she was actually, excited about this. And that's when she found Eve. Eve actually messaged her on Facebook to connect about their paths crossing and to explain her story. So with Eve fighting for a change in the statute, Jessica filed a complaint with the Texas Medical Board along with her mother and Eve's mother. So Jessica's thing is like, okay, Eve is doing this, the law passed. But because it's not retroactive, he will not be held accountable. He is still practicing.
So his medical practice is still open.
Oh, correct.
Correct. He works
in October, someone gave him a review. There's some scathing reviews out there.
Well, sure.
Well, that's what happens when you rape people, I think. So Jessica wants him held accountable and not to be allowed to practice medicine. She found some of her half-siblings that didn't know they were related, but they knew each other in college. So not Jessica, but two other people that knew each other. So her thing is, what if they date or get married?
Yeah.
That is her logical thing because Nacogdoches is small.
Yeah.
You're going to meet people. And regardless, it's fucking weird that people do this.
Well, and just, you have a right to know your genetic information.
Right. Yeah, so Jessica's thing also is we're all disgusted at this point, but she's upset because her mom was so vulnerable in that time, desperate to have a child, and he knew that, and then he used sperm, that he knew she would not agree to.
But my biggest issue with all of this is that the people in this position are really vulnerable and are coming to you because of your medical expertise and what you have to offer them.
Yeah, and they're desperate.
As a physician, what you have to offer them is the ability to help them with things like IVF.
And isn't it first do no harm?
Yeah. Yeah. This whole thing feels...
I'm just blinking.
The blinking. The angry blink.
I'm
you surely knew that if this came out, someone would be upset about it.
Which is why you kept it a secret, you prick.
It feels like you're very obviously doing psychological harm to people.
I agree. Or you love keeping a secret because you love thinking about how many women you've impregnated because you're into them. That's
terrifying.
That's what I think is going on.
You think that's what it is?
I think he's I'm a doctor. I have superior genes.
That's what I think it is too.
I think he thinks it's funny. I think he gets this weird, gets excited whenever he realizes that his sperm solved the problem. He's like, yeah, look at me.
Yeah.
Look at my 70-year-old sperms just running around.
I feel almost like it should be illegal as a physician to keep your own samples at all.
Oh, I 100% love that.
Even if you get permission from the patient, I don't even think that should be really an option to give your own sperm because someone who is like this, right? So, okay.
Narcissists,
Yeah,
Yeah.
it's very narcissistic. And I feel like I want to take a step back for 1 second and talk about the true motivations of rape. Because it's all about power,
Yes.
right? He has power over these women because they're coming to him in such a vulnerable position.
Yep. So Jessica, her mom, Eve's mom, filed these complaints with the Texas Medical Board.
Yeah.
Okay, so a hearing was supposed to happen mid-September.
Of this year?
Yeah.
Topical.
Yeah, but it's a closed hearing. So I do feel that they're going to do something. I think he is close to retiring, so I think they'll offer him like this ability to retire before they like pull his license.
Yeah.
I was trying to think about, because so online, right? People are like, well, they wanted to get pregnant. Like that came up a lot. Like people were like, well, what do they expect? Like you want pregnant, you got a baby.
Ew.
Yeah, and it's like, okay, well, I mean, I hate the idea of having to even explain that this was wrong, right? So I was thinking about it, and I was like, no, fuck their side. Because everyone's always saying to me that I don't listen to everyone's side, so I'm trying to be a better person. But, like, fuck that side. That doesn't make any sense to me. I'm not going to see your side of the story here.
I fully agree with that.
It's so bad.
It's like, if you work at a restaurant, and you put your bodily fluids
gross, yes,
into someone's food, right? You're going to be charged with something.
Right.
Like, you can't use your bodily fluids on people without their knowledge, right?
That's a fucking point, Sydney.
And so...
That's good, girl.
Thank you. Oh, thanks. So, at bare minimum, putting your sperm, your bodily fluid into someone without their knowledge is at the very minimum the same as, like, spitting on someone's hamburger.
Yeah.
Right? Like, that was already illegal.
Well, I also feel like if you are a medical personnel and you are administering your own sperm and you don't disclose that or the patient does not agree to it, I believe that when it comes out or whatever, that you should have to pay child support.
Yep.
And I think, like, yep,
that's your baby.
That's what I think. You wanted over 60 kids, Dr. Klein or whatever.
Pay me.
I think that when you are convicted, because it's not like you can deny it.
No, you did it.
You did it. They're there.
Yeah.
And if the child is an adult, there should be back pay. That's what I think.
They obviously knew that they were doing something wrong because they never told the patients they were doing it.
Oh, for sure.
If you think that what you're doing is all above board, why wouldn't you tell them?
Yeah. Why?
Until 30 years later.
Because you'd never tell them. Ugh, the audacity to email it to a patient's daughter.
Who is your daughter?
Ooh, it just makes me sick. He's gross.
He's super gross.
So that's where we stand. I think that in the next 2 years, we're going to have a lot of other laws coming out in other states. I hope that there's a federal one. Like, I can't see a reason not to have a federal law that just covers this.
So IVF is not that old, but it's old enough that this has been happening for a long time.
Yep.
As long as these fertility doctors have been practicing,
it's been happening.
Who's to say how long they've been doing it? This is disgusting.
Yeah.
I'm disgusted.
I am too, and I urge anyone who finds out that this has happened to promptly file a police report, because it's when and make a complaint in the medical board, because when it becomes common, that's when things change. Like, Eve had to push. Like, Jessica is going to have to push to get this changed and to get accountability. And it's just unfortunate that it has to be the products of medical rape who are, like, fixing it. It should have been taken care of a long time ago. Yeah.
It's really unfortunate that, and it seems like this is always the case, especially in the criminal justice system, the onus is always going to fall on the victim, and that sucks.
Yeah. I mean, it's wild to me that you can go to jail for a small possession of marijuana, but you medically rape up to and over 60 people, and you are scot-free, out and about, living your life. Get a DNA test, you guys.
Thanks for listening to Malpractice Podcast.
If friends, so I know you're really enjoying this podcast. Thank you for being here. We also have social media. Follow us on Twitter and Instagram for a good time.
Also, if you'd like to hear your story featured on our podcast, or you have a weird or interesting or funny medical tidbit,
or if you just want to, if you have a topic, you're like, can you cover this?
Yeah. You want to learn more? We'll learn it for you.
Yeah. That's our jam.
Yeah. Send us an email at malpracticepodcast@gmail.com.